And hello everyone and welcome. Thank you for being here. I'm Lindsay. I'm the program coordinator at the Long Meadow Adult Center. And today we have with us Luisa and Lisa, both from Blue Cross Blue Shield, and they're here to talk to us about Medicare and specifically counting down to 65. We are recording today so we can share with LCTV and Valley Eye Radio. And thank you to those two groups for being a part of our programs with us. So I will turn it over to Luisa. Thank you.
Thank you, Lindsay. Good afternoon, everybody. My name is Luisa Lewis, and I am a senior plan consultant with Blue Cross and Blue Shield. And with me is Lisa Farnham. And Lisa will be managing the questions that you may have throughout the presentation. We're very excited that you are joining us this afternoon to go over planning for Medicare, countdown to 65. A couple of housekeeping. We're going to take ourselves off video when we start the presentation. We like you to write down any questions that you may have throughout the presentation, and we'll address them at the end of the presentation. So Lisa will be able to do that for us. And with that, I am going to take my face off video so we can focus on the presentation. So on today's presentation, we're going to be talking about Medicare and Medicare-related options, and that's section 1. And this section is the longest part of the presentation, and we're also going to be talking about options if retiring before Medicare eligibility. That's a pretty quick section. It probably goes between 5 and 8 minutes. The total duration of the presentation is about 45 minutes. And one thing I'd like to definitely acknowledge is that this is a very high-level presentation. We are not going to be presenting any specific Blue Cross information. So we just want you to learn what you have available when you're approaching 65, and that's basically how this presentation it's going to go. So with that, this is the slide that we based the entire presentation. You first of all are here mostly because you will become Medicare eligible, and with that you'll be eligible for Parts A and B. And for most people, staying on original Medicare may be all they need. On a high level, it is an 80-20 plan in which Medicare covers you at 80%. If you're looking to add coverage to original Medicare, there are two paths that you can consider. To the left, we have Medicare supplemental plans. If you're looking to do a supplemental plan, you definitely want to think about a Medicare prescription drug plan or Part D. Medicare supplemental plans do not include prescription coverage. Or you may think, well, I like to go with the Medicare Advantage plans. That is the path on your right. They're also known as Part C, optional replacement to Medicare. Most Medicare Advantage plans include prescription coverage. There isn't any right or wrong to either path you choose. What you really need to think about when you're making a decision is what are your specific medical needs, what is your financial situation, and then what is the flexibility that you're looking to have on a plan. In average, a supplemental plan is more expensive compared to the cost of Medicare Advantage plans. On Medicare Advantage plans, you would have to consider the out-of-pocket that you will have to spend each time you're using the plan. So those are two things that you definitely need to keep in mind when you're making a decision on which way to go. What is original Medicare? It is health insurance provided by the federal government, and it consists of two parts. Part A for inpatient care, and Part A is mostly premium-free for the majority of people. Part B pays for doctor services and outpatient care, and the cost for Part B is $144.60 per person per month for most people. And this is the cost for 2020. If you happen to be on a higher annual income, then chances are your premium for Part B may be higher. How it works, it really is very simple. You see any provider who accepts Medicare across the country. No primary care provider is required. No referrals are necessary. And all you need to do is to pay deductibles and coinsurance. And on this slide, we provide you with a visual of what the Medicare card looks like. When and how to enroll. If you turn 65 and are collecting Social Security, this is one of the scenarios we're going to cover. There are three that you'll need to think about depending on your situation. You should automatically receive your Medicare card 3 months prior to your 65th birthday. Coverage starts on the first of the month of your 65th birthday. Unless you were born on the first of the month, then coverage begins the first of the previous month. So for example, if you are born on October 10, your Medicare starts on the 1st of October. However, if you are born on October 1st, then your Medicare coverage is effective September 1st. It's the previous month. The second scenario, if you turn 65 and are not collecting Social Security and you want Medicare coverage, you definitely need to do something about this situation. You need to contact Social Security 3 months prior to your 65th birthday. Your initial enrollment period to sign up for Medicare is 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after. If you continue to work past age 65, that's another scenario. And this is a scenario that we see more and more nowadays. People are definitely staying at work past age 65. In this scenario, you contact Social Security to enroll in Part A, which is optional. You don't have to do that, but you can. But you can delay signing up for Part B beyond age 65 with no penalties, as long as you have group insurance from an employer that has 20 plus employees for whom you or your spouse are actively at work. So that's very important and key when you are still working after age 65. The company size that you or your spouse are actively working has to have over 20 employees. However, if the employer has less than 20 employees, check with the benefits administrator about the options you have to continue with your employer coverage after Medicare initial eligibility. When you or your spouse stop working or your health coverage ends, you'll be entitled to a special enrollment period. You definitely want to contact Social Security to ask about your personal enrollment period. And the only thing that I need to make reference here is if you are contributing to an HSA, you cannot be on a Medicare Part A. However, you can stop that contribution 6 months before you turn 65. You can use the funds you already have in an HSA to pay for any medical expenses. And what that is, many of us may have through work a high deductible plan available to you and enroll in an HSA account. So for that situation is why we put this note at the bottom of your screen, because you definitely need to keep that in mind. On original Medicare Part 2020, and in here in this scenario or in this table, we're basically saying if all you are considering is staying on original Medicare, we are going to talk about the out-of-pocket expenses that you have to keep in mind. So as we indicated earlier, Medicare Part A covers inpatient hospital. And in here, if you are in the hospital on an inpatient stay from days 1 to 60, you would have to pay a $1,408 deductible. If you're still in the hospital after day 61 to day 90, you still cover and you pay a daily coinsurance amount of $354. If you're still in the hospital after day 90 to 150, These last 60 days are called lifetime reserves. And the lifetime reserves, once you use them, they're gone. They don't come back to you. And during this period, you pay a daily coinsurance of $704. And there is no coverage after day 151 in the hospital. So just to give you an example, if you have knee surgery, and you go to the hospital and hospitalized for 5 days, you are responsible for paying the deductible of $1,408. However, if you have to come back to the hospital 3 weeks later for the same condition or a different diagnosis, you are not required because you are in the same benefit period. And the benefit period starts from the first day that you were admitted to the hospital until the day that you are released from the hospital. And benefit periods are 60 days. That's what the benefit period accounts for. So keep that in mind. However, if you come back to the hospital after 4 months, after your knee surgery, you will be required to pay that deductible again. If you've been in a hospital and have been inpatient and now you need to go to a skilled nursing facility for some sort of rehabilitation, the key here is that you must have been an inpatient patient for 3 days or more in order for Medicare to pay your day 1 to 20 at 100%. If that was the case and you're still in the hospital or in the skilled nursing facility after day 21 to 100, you're covered, but you have to pay a daily coinsurance amount of $176 per day. And there is no coverage after day 101. Medicare Part B, it's definitely easier. And that Part B covers you for doctor's visits, lab, x-ray, emergency room, ambulance, physical speech, occupational therapy, that sort of thing. And for Medicare Part B, coverage will begin after you pay the 198 calendar year deductible. And after that deductible has been met, then Medicare pays 80% of the Medicare approved amount. You then pay 20% coinsurance. Not covered by original Medicare. So if you decide that original Medicare is the only thing you want to keep and not add anything, then keep in mind that original Medicare does not include prescription coverage. You will not be covered if you travel outside of the US, routine vision, routine hearing, and routine dental is not covered. Now we're going to talk about Medigap plans. And a Medigap plan is a plan that you add to original Medicare. And Medigap plans are also known as supplemental plans. So if you have done a little bit of reading, you may have come across the same, either Medigap plan or supplemental plan. They are the same, they have the same meaning, and it is to refer to Medigap plans. So just keep that in mind. Medigap plans pay Medicare's deductibles and coinsurance costs for you. In Massachusetts, Minnesota, and Wisconsin, Medigap plans are standardized in their own way. However, anyone living outside of these 3 states, the rest of the country has 10 standardized plans available to them. And I'm going to provide you with a visual of what that looks like. But again, the offerings in Massachusetts and Minnesota and Wisconsin, when you're looking at supplemental plans, they look the same. They have about the same 3 coverings available or coverage available to you. And how you receive care. When you are on a Medigap plan, you will need to show your original Medicare and private insurance cards. You need to show both. Medicare pays first, then the insurer pays the balance based on plan design. Key points, you can see any Medicare provided nationwide, no referrals, no co-payments. And so basically, Medigap plans provide you with a lot of flexibility because you can go anywhere in the country, and as long as you see a Medicare provider, you should be covered. This is what the landscape looks like in Massachusetts. There are 3 plans available to you, and they are known as Supplemental Core, Supplement 1A, and Supplement 1. And if you had heard anything, there was a Medicare law that was called MACRA that was introduced on 1/1/2020. And that law really subjects the eligibility for Medicare Supplemental 1 to people who turned 65 prior to 1/1/2020. So if you turn 65 after January 1st, 2020, the Supplement 1 is not available to you. However, a new plan called Supplement 1A was introduced and is basically the same plan, except it does not cover the deductible for Part B. So as you can see on this in this graph, by looking at the green checks, anytime you see a green check, it means that the plan covers that balance for you. So Medicare Supplement 1 is the most comprehensive of them all. You do not have to pay any out-of-pockets for any of the services that you see here. It is all picked up by Supplement 1. If you move to Supplement 1A, again, the only difference between the two would be that they don't cover the $198, the calendar deductible. And none of the plans here cover a prescription drug plan. If you're looking at a supplemental core, you would have the leaner coverage available to you. So just as a summary on a core, if you are on this plan and you have an inpatient stay, you will be picking the deductible of $1,408, but you would be covered if you were enrolled in a Supplement 1A or Supplement 1. If you have an inpatient stay from days 61 to 90 and days 91 to 50, that daily coinsurance would be picked up by all plans, so you don't need to pay any out of pocket for that inpatient number of days beyond 61. If you are on the core and have a skilled nursing type of benefit, you would be paying from days 21 to 100, and that's $176 a day, but you wouldn't be paying that amount if you are in the Supplement 1A or Supplement 1. And the same goes for the Part B deductible. You would actually be paying that deductible if you were on the core or Supplement 1A, but you wouldn't if you had the Supplement 1. All of the plans pick up that 20% Medicare approved amount, so you don't have to pay that one. And if you receive care outside of the U.S., most supplemental plans do pick it up. There are some core plans that don't. So in here, just gives you an idea which of the plans definitely would cover you for out of the U.S. Benefits if you're traveling outside of the U.S. So that is in essence of what your choices are when you are in Massachusetts and looking at supplemental coverage. Now, if you were not in Massachusetts, this is what it would look outside of Massachusetts. And as you can see, there would be the 10 plans available to you to choose from. Not every insurance company offers you the 10 plans. Some do and some may not. But again, this is just to give you a visual on what the plans look like. And again, if you're not in Massachusetts, you may want to contact the SHIP office for more information because plans have different underwriting guidelines, pricing, and offerings. Now we're going to talk about Medicare Part B. And Medicare Part B is the prescription drug insurance offered by private companies. You may pick up a standalone Medicare Part D if you are looking at a supplemental plan or so. But they also, just as a refresher, Medicare Advantage plans, most of them do include a Medicare Part D component. So keep that in mind when you're looking and comparing plans. Medicare Part D plans cover outpatient prescription drugs that include coverage for brand name and generic, and they usually have a network of participating pharmacies for you to purchase your prescription. You would pay a monthly premium to the insurer. You would be able to purchase your prescription at retail or mail order pharmacies. One very important thing when you're looking at Medicare Part D is to check the formulary. And the formulary is the list of covered drugs. And keep in mind, plans have different formularies. So one plan may cover one medication, but the next plan may not. So when you're looking at Part D, it is important that you research ahead of time to see if the prescription that you're taking is covered by the Medicare Part D plan that you are interested in joining. And one last thing, join when first eligible to avoid a potential late enrollment penalty. And this is very important because if you do not pick up a Part D plan, let's say that you have a Medicare supplemental plan that doesn't offer a prescription plan, obviously they don't. So if you need, one thing you need to know is you must buy a Part D plan because you will have a penalty if you don't. And the penalty basically is based on the national average cost of prescription plans, and it's 1%. And the national average cost for 2020 is $33. So that would be 33 cents. And so you would think, oh, that's no big deal, but it really compounds and it will keep adding out for every month you're not enrolled in a Medicare Part D. So if you went without a Part D plan for 3 months, your penalty is 99 cents tackled to the cost of your plan. And that cost and that penalty follows you forever, wherever you go. So that's important. And one thing is there are Medicare Part D plans that are as low as $15. And again, check to see if the lower cost Medicare Part D plans would provide coverage for the prescription that you're currently taking. And this is what a Medicare Part D plan looks like and how it works. So first of all, there is a deductible, and the deductible is something that you need to pay upfront before coverage begins. And the coverage depends on, depending on the plan, it applies usually for prescriptions that are tier 3, 4, or 5. But again, you need to, when you're looking at specific plans, just keep in mind to review which plans are impacted by that deductible. No matter where you go, you would always see the 3 levels of coverage that are listed on this slide, which are the initial coverage, the coverage gap, and catastrophic coverage. Under the initial coverage, every year the federal government allocates an amount that gives to you every January. It resets, and that amount for 2020 is $4,020. So you get that amount, and that is the amount that you will use to basically purchase your prescriptions, and in including your share would be you would pay co-insurance and co-pays. And what happens is once you finish that amount, once you're done with that amount, then that means that you are done with the initial coverage and you're moving into the coverage gap. And under the coverage gap, and it used to be known as the donut hole. I don't know if you remember that back in probably a few, I don't know, it's been about 10 years, I think, that the donut hole was popular. So under this coverage gap, you are paying a percentage, and you're basically paying 25% of the cost for covered brand drugs and 25% of the negotiated price, excluding dispensing fees. Some pharmacies may charge you $1 or $2 to dispense your medication. And once you have combined out-of-pocket costs that it's through the initial coverage, which is going to add up your copays and coinsurance, plus what you have spent in the coverage gap, which is that 25%. Once your out-of-pocket reaches $6,350, you now have moved into the catastrophic coverage. And under this coverage, you are paying the greater of $3.60 for generics, or $8.95 for all other drugs, or 5%. Again, is the greater of the two. Medicare Advantage plans, they're a little easier to understand because everything pretty much happens under one umbrella of the Medicare Advantage plan. Under this concept, the federal government pays or subsidizes some of your premium to the private insurance companies. And in return, private insurance companies provide to you a network of doctors, of hospitals, and other providers. And in addition, they provide you with additional benefits that are not covered by Medicare. And it depends on the plan that you're looking at. Some plans will include preventive or routine vision and hearing. So that is something that, again, the private insurance companies add to your benefits. And in return, you're paying your premiums, you're paying your cost share, and you have to follow the plan rules, which means networks and whatever other guidelines each plan imposes on you. Medicare Advantage plans provide all original Medicare benefits, Part A and Part B. And again, in addition, provides you with routine vision, hearing exams, preventive dental, and includes prescription drugs. Most of them do. And under the Medicare Advantage plan, they're going to be more familiar to you because they're going to resemble your employer plans. They're going to be HMOs and PPOs. And under these scenarios, you're going to look at the plan that probably provides you with the greatest flexibility. Medicare HMOs, you need to designate a primary care provider. You need to use in-network providers for most of your care, and you just pay co-payments and co-insurance. If you're looking to have a bit more flexibility, you may consider a PPO plan. They may include physicians of choice. On a Medicare plan, the beauty is that you can use the network providers, but you can also able to go out of network. You generally pay more for out of network care. You pay co-payments and co-insurance as you go along. We probably could spend a lot more money, but I'm going to be very brief because I'm going to give you just the big headline information of what you need to know about the open enrollment time periods that you can enroll in the different plans. First of all, the first one would be your initial eligibility, and that happens 3 months before your 65th birthday, the month of your birthday, and 3 months after. Or Medicare due to disability, 3 months before to 3 months after your 25th month of disability. You also have the annual election period. And here you're going to start noticing, you're going to start getting a lot of mail, you're going to see a lot of ads on TV. And that period starts October 15 to December 7 for a January 1st effective date. You also have a Medicare Advantage enrollment period that goes from January 1st through March 31st. And in here, if you are in a Medicare Advantage plan, you can switch to original Medicare or switch to another Medicare Advantage plan. Coverage will begin the first of the following month after the plan receives your enrollment form. And there are also special enrollments to consider, and they can be due to a loss of health insurance, employer insurance, or you moved in or out of the service area. So when we talked at the beginning, we made reference that if you were on a higher income premium, that you may be required to pay a higher Part B premium. And in here, it's a threshold of what those amounts do look like. So for example, if you are making above 87,000, or the range from 87 to 109, or married couples ranging from 174 up to $218,000, you would pay $202.40 for Part B premium, and you pay an additional $12.20 for prescription drug plans. So again, this is just a visual to give you what it really happens if you are on a higher income bracket. We provide you with some national resources that you can call. This is information that it comes to you or that you will have access to. And one of the most important things that you may have seen or soon to see would be the Medicare Annual Handbook. And this is a great handbook. It has really detailed information about Medicare, about plans available in your area. So it's a great resource to have. Massachusetts resources, I can't talk enough great things about SHINE. And SHINE stands for Serving the Health Information Needs of Everyone on Medicare. They're great. They are at your senior centers, and you make an appointment to talk to them. And I don't know if now the appointments will be happening on the phone, but it's really, really good. If you're struggling to pick a plan that makes sense to you, they are really great. They know everything about every plan. So I highly, highly recommend that you reach out to a Medicare Shine if you definitely need some help making decisions. We also have a Mass Medline, which is pharmacy outreach, and it helps you with affording prescriptions. It gives you information on help on medication and side effects. You also have the Prescription Advantage program. And this program helps you if you're having issues paying for prescriptions. They can help you if you qualify based on their guidelines. They can help you pay for your prescriptions. And we here have the Blue Cross and Blue Shield number if you need that as well. Now I have finished the first section of our presentation, and now we're going on to the next section, which is section 2, and its options if retiring before Medicare eligibility. This is probably a very expensive time period for you if you retire younger than 65, when you need coverage for family members if you retire at or past age 65. So we have really put them here in the order that we feel best helps you. So when you're looking, you have to consider which plan would be best for you based on price probably, and whether or not your providers are in the plans that you're reviewing. What is the plan design? What are the costs? A lot of that goes into making a decision of what option would make best sense for you. If you're looking to join your spouse's or partner's health plan, you would join the group coverage, which is great because you may be more familiar with that type of benefit. All you need to do is really follow the eligibility, the rules or guidelines by your spouse's plan. And the great thing is that employer plans are usually subsidized. They subsidize the cost of the premium. So it does give you a little bit of a break when you're adding yourself to your spouse's plan. And most of they are payroll deductions, so you would not have to worry about doing a monthly check to the plan. So that is probably one of the best options if it is available to you, again, based on cost and convenience. COBRA, which is the Consolidated Omnibus Budget Reconciliation Act. And COBRA is temporary continuation group coverage. And it's easier because it is a plan you've been accustomed to, so you at least know how the plan works. And COBRA is available to former employees, generally up to 18 months, and to spouses or dependent children, generally up to 36 months. And the qualifying event is termination of employment, divorce, legal separation, or death. And on the COBRA, you would have to pay 100%, sometimes even a bit more than the 100% of the premium. But again, it's another option you may have. And direct pay plans. You can consider a direct plan if you aren't eligible for group employer coverage, or if you don't qualify for state or federal government programs such as Medicare and Medicaid. And you can look, on direct plans, they include individual, two-person, or family health insurance, and you would purchase directly from the insurers, and premiums are billed directly to the subscriber. So just to give you an idea, they are very expensive. Direct pay plans are very expensive. Some of them starting at $800 or $900. So it is not a very cheap option for you to consider, but it's out there. And if you qualify for a subsidy plan, you may want to take a look at what's available to you through the connector plan. So again, those are options that you have available. And now I have come to the end of the presentation, and I'm going to turn it over to Lisa to see if we have any questions or if she has anything else to add.
Hi, Luisa. Great job. I did not get any questions. So just as a reminder, if anybody does have any questions, you can just put them right in the chat and write them there. But I didn't get any questions. I think I'll just maybe summarize and remind folks a couple things from Luisa's presentation. First, everything that Luisa talked about today from a premium and a benefit perspective, we're talking about 2020 benefits and premiums and dollar amounts. So things will change each year. So these amounts are definitely subject to change. We won't know about the changes for next year until October or so, but we don't yet know the new amount. So just as an FYI, the other thing is each year formularies change and benefits change. So you definitely, it's okay to make an appointment with a Shine counselor or sit down and look at, what's new for you personally from a financial or health perspective in a given year so that you can make a different decision. And Luisa talked about the times where you can make changes to your plan. So that's important to remember. You're never stuck in any one plan. There are times where you can change. There's at least once a year. And for a few other plans, there may be more than that. So the other thing I'll add, and then I'll turn it back to Luisa, is that all of these plans, different from when you were working, they're individual plans. So these are just one-person plans. So you and your spouse do not need to take the same plan. Again, if you have different health situations or even just a different risk tolerance, you can take different plans. So you definitely do not need to both sign up, even for the same carrier. So you can choose, what's right for you. And I know Luisa said this, but I cannot recommend Shine counselors enough. They're wonderful. It's a volunteer position. They go through extensive training. They're really super knowledgeable, and they're really helpful. And if you do need to make an appointment during like the open enrollment period, October to early December, I'd make it fairly soon because they definitely do get filled up. So that's it, Luisa. I will turn it back to. Oh wait, now I have a couple questions.
Awesome.
I knew if I talked a few minutes there. So the Shine appointments can be made through your senior center, so through your Council on Aging. So Lindsay can help you with that. And then we had a question: how can we get a copy of the Medicare and You booklet? And you can, if you want to go back to the resource page, there's a telephone number for Medicare.
Okay,
I
yeah.
think you just passed it. There you go. So you can call Medicare at that 1-800-Medicare number. I'm not personally sure if you can try the website, and I'm not sure if you can request the Medicare and You handbook through that, but you could try that first. I know you can get it by phone. And then the other question I got was, is there a website to look up the prescription drug plans to choose from? So there's a couple sites. One of the great sites is the Medicare.gov site that's right here on this slide. And you can use that site to look up prescription drug plans. They're all there. You could also call any of the insurance companies to see what plans they offer, but this Medicare.gov site shows you all of them together in a comparison. And then again, meeting with a Shine counselor, they can provide you with information on what's the best prescription drug plans for you as well. So I think that's it. So I'll turn it back to you, Luisa and Lindsay.
All right. Thank you so much for the audience for attending, and thank you, Lindsay, for organizing this event. We're very happy that we had quite a few people joining us. We love the audience, so I thank you for that. And we can do this as frequent as you like. It's the resources available that we'd be happy to do for you. But thank you for doing and organizing.
Thank you so much, Luisa and Lisa. Thank you for your time. And thank you to everyone who popped on, like you said. And hopefully we can meet again.
Thank you so much.
All right. Thanks a lot.
Thank you.
Bye-bye.
Bye, everyone.